Today we're in the beautiful parish of St. James, Montego Bay, and we're here with Mr. Eroll Greene, the Regional Director of the Western Region Health Authority. Now, this region covers how many parishes, Mr. Greene?
4. Trelawney, St. James, Hanover, and Westmoreland.
Wow, that's a lot of health centers to deal with and hospitals, right?
About 88 health centers, 4 hospitals, including a regional hospital.
Wow, what has it been like since the pandemic has come in for you guys?
It has been stressful. It has been challenging, but we have a tremendous workforce, or doctors or nurses or public health professionals or maintenance persons,
right,
or officers in the regional office.
Right.
Everybody recognize the challenges and we pull together as a team to face the challenge.
Wow, and we take our hats off to you.
Thank you.
But some of the challenges that you're experiencing, because we know, these workers are on the front line.
Yeah.
There's a great need for many items. What are some of the items that you think you
Well, the biggest challenge is PPEs and I would say medication to the pharmaceuticals to a greater extent.
Right.
But PPEs, because there's a global shortage or global demand for increased global demand for PPEs.
Right.
And we have been blessed. Food for the Poor has stepped to the plate. They have assisted us greatly in providing some of these PPEs and equipment for us, ventilators and so on.
We were just in clusters across the island, but now the government, through the ministry, has declared a community spread. How has that impacted your region?
Well, it has impacted us because there's a greater demand now for our services.
Right.
In fact, for the past 3 weekends, we have been doing sensitization sessions in Montego Bay. This requires going out into the communities, quite a bit of public education, distributing literature, distributing PPEs, encouraging persons to wear masks, teaching them how to do that, distributing hand sanitizers, and so on. And we were able to do that, and we have been doing that over the past several months.
Right.
Through the generosity, as I said, of companies like Food for the Poor.
Right.
Here it is. These are some of the masks that when we go out in the field, we are able to give to persons, and there's always a great demand for that. But even greater still, and perhaps one of the issues that is highlighted is the challenges that are faced by our workers and others in our community. Right. We have seen where quite a number of persons have lost their jobs.
Wow.
In this region, we're heavily dependent on tourism.
Yes.
Tourism took a blow.
Right.
We're trying to build tourism back.
Right.
And there is a domino effect because we've seen workers, for example, whose husbands or wives would have worked in the tourism industry there without a job, so the strain is on them.
What would you like our donors to assist you with now?
Well, of course, the PPEs can't be too much.
Okay.
Food items and care items can't be too much.
Right.
Ventilators and other machines, X-ray machines and so on, can't be too much.
Right.
We know we get a good stock of medication from Food for the Poor from time to time. We're grateful for those as well.
Right.
And just about anything that goes into the running of a hospital or a public health facility, we'd be grateful for.
Okay, thank you so much, Mr. Greene. It is
Thank you so
indeed
very
a
much
pleasure,
for having us.
and we really appreciate you taking this time.